Welcome to The Explainer. Today, we're diving into something I'm super excited about, a look at how you, as clinical practitioners, can totally upgrade your daily practice. We're talking evidence-based medicine, or EBM. But look, we're not just going to sit here and talk theory. We're going to uncover why there's this massive gap between the incredible research published every single day and what actually happens when a patient sits down in your exam chair. If you've ever felt completely overwhelmed by all the new clinical guidelines or caught yourself relying on outdated habits simply because you just don't have the time to sift through all the noise, well, this explainer is exactly what you need. Okay, let's dive right into this. 21%. Honestly, this is a staggering, frankly shocking statistic. Out of all the valid, rigorous, peer-reviewed clinical research out there, only 21% actually makes it into everyday clinical practice. I mean, think about that for a second. Nearly 80% of hard-won scientific advancements, stuff that could literally be improving patient outcomes right now, just evaporates. It never reaches the patient. So what's going on here? How does such a massive disconnect happen between the lab and the clinic? Well, implementing research isn't just one step, right? It's a cascade of what we call leaks. First off, you got to be aware of the research. Then you have to accept it. Then you got to target the right patient, make sure the treatment is actually doable in your clinic, recall the info at the exact right moment, agree with the specific application, and then finally actually get it done. Whew! If a practitioner gets an 80% success rate at each of these individual stages, which, sounds pretty great on paper, the compounding effect is actually devastating. 0.8 to the power of 7 is 0.21. That's literally how losing just 20% of the momentum at each stage results in an abysmal 21% final implementation rate. We're losing valuable clinical data at every single step. So how do we fix the plumbing? How do we stop these leaks?
Here's our roadmap for today. First, defining evidence-based medicine. Second, the 5-step EBM process. Third, formulating questions with PICO. Fourth, hunting for the evidence. And fifth, evaluating and implementing. And I really want to explicitly credit the brilliant foundational lectures of Dr. Dirk J. Boozen here. Dr. Boozen's comprehensive guide to EBM and optometry for postgraduate students is our definitive roadmap for this explainer today.
All right, let's kick things off with Section 1, defining evidence-based medicine and how it integrates research, expertise, and values. There's this common misconception that EBM is somehow restrictive. A lot of practitioners worry it's just cookbook medicine created by administrators to cut costs and suppress clinical freedom. But as you'll see, that couldn't be farther from the truth. EBM is actually a profoundly empowering clinical tool. Take a look at this foundational definition from Sackett and Strauss in the British Medical Journal. Evidence-based medicine is the integration of best research evidence with clinical expertise and patient values. The absolute key word here is integration. EBM doesn't ask you to toss out your clinical judgment and just blindly follow a manual. No way. It asks you to deliberately integrate your hard-earned, on-the-ground clinical expertise with the absolute best scientific validity out there.
And this brilliantly illustrates the point. True EBM rests on 3 intersecting pillars: research evidence, patient preferences and actions, and clinical state and circumstances. And perfectly overlapping all 3 of those, that's your clinical expertise. Think about it. You can't practice true evidence-based medicine if you're ignoring what the patient actually wants, or if you ignore the specific clinical situation right in front of you. Your clinical expertise is literally the glue that binds the scientific data to the actual human beings sitting in your chair.
Moving right along to Section 2, the 5-step EBM process. This is your blueprint for everyday practice. So, practicing EBM isn't just some abstract idea. It requires a really specific logical methodology. Here are the 5 distinct steps you need to weave into your clinical rounds. Step 1, formulate an answerable question. Step 2, track down the best evidence to answer it. Step 3, critically appraise that evidence to see if it's valid. Step 4, individualize the care based on your clinical expertise and your patient-specific concerns. And finally, Step 5, evaluate your own effectiveness and efficiency. Keep a record. Continuously improve the process. These 5 steps form the absolute definitive backbone for upgrading how you deliver healthcare. Okay, Section 3, formulating questions with PICO. Think of this as your clinical cheat code. Studies show that on average, clinicians ask about 2 to 3 questions per patient. These might be fact-based, like drug doses, or questions about diagnostic accuracy, management options, or prognosis. But here's the catch. If you don't structure those questions properly, you are going to waste hours searching for answers. Enter PICO. This is your ultimate mental shortcut. PICO stands for population, intervention, comparison, and outcome. So when a clinical question pops into your head during an exam, you immediately run it through this filter. Who is the specific patient population? What intervention are you considering? What are you comparing it to? And what specific clinical outcome are you actually hoping to achieve? This little shortcut transforms a vague, fuzzy thought into a highly specific, easily searchable query.
Now, what's really interesting about this is how it looks in reality. Let's combine PICO with Rombo, which by the way is just a handy tool to check if study methods are valid. Imagine you have a question about amblyopia. Instead of just hopping online and searching amblyopia treatments, you use PICO. Your population is children under 5 years with amblyopia. Your intervention is the use of eye patches. Your comparison, eye exercises. And your outcome, finding out which is more effective in increasing visual acuity in the affected eye. Do you see how much more powerful that is? You've just built a laser-focused search query.
Next up, Section 4, hunting for the evidence. Basically, finding the signal in the noise. Look, as busy clinicians, your time is your absolute most precious resource. You cannot afford to spend hours scrolling through irrelevant articles. You need to know exactly where to look for high-quality, pre-appraised answers. So here's your essential toolkit of search engines. The absolute gold standard? The Cochrane database of systematic reviews. To put it into perspective, the Cochrane collaboration has collated over 450,000 randomized controlled trials and produced more than 4,000 critical summaries. It is an unbelievable resource designed specifically to take the sting out of keeping up to date. You should also be tapping into PubMed, the TRIP database, Google Scholar, and the Oxford Center for Evidence-Based Medicine. And hey, a quick pro tip for you. Always search for secondary literature first, like systematic reviews and clinical guidelines, before you go diving into individual primary clinical trials. And finally, Section 5, evaluating and implementing, making it actually work for your patients. So, the crucial point is that finding the evidence is really only half the battle. Integrating it into a fast-paced clinic, that's a delicate balancing act. On one side of the scale, you have the effort to learn and the effort to use. Because, let's be honest, implementing EBM takes work. It takes time to learn PICO, get familiar with Cochrane, and change your clinical habits. But consider the other side of the scale, the perceived value of EBM. Once you realize that applying the system means delivering scientifically validated, individualized care that genuinely improves patient outcomes, well, the immense clinical value completely tips the scales. That initial effort is vastly outweighed by the long-term benefits for both you and your patients. Which brings us to our final question. We started today by looking at that shocking 21% implementation gap. We looked at the leaks, the PICO framework, and those deep insights from Dr. Buisen. The tools are right here. The methodology is totally proven. So the challenge I'm leaving you with today is simply this. Will your practice be part of the 21% that successfully implements the best available research? Or will you be part of the 79% where vital knowledge simply leaks away? The choice of how you upgrade your practice is entirely up to you. Thank you so much for exploring this with me on The Explainer, and I'll catch you next time.